is D Durrell with D Durrell Life Solutions. I am having an excellent day today. I am just, basically taking a break, and I'm gonna chit chat with you all for maybe about 30 to 40 minutes or so. And I want to talk about therapists on YouTube. Okay, I'm gonna kind of let people come in. Notices I like to do these impromptu videos. I have been extremely busy over the last week or so. Um, had a lot of things going on professionally and personally. Had to send my son back off to college. He's doing well. He's ready to get things going, get things cracking on the football field, and academically he's solid. So I've been focusing with him, focusing on business, focusing on things in Dallas, focusing on things with my family back home in Louisiana. I've been dealing with a lot, man. So I just wanted to come back in and say, okay, let me. I've been watching YouTube on and off. I'm gonna be honest, man. I have divested a lot from YouTube lately. I have divested a lot of my time away from YouTube. Um, I have a lot of different ideas of different content. I have several consultations that I uh, have gotten, have obtained. I have of about 4 or 5 book recommendations and promotions to do. I got several book promotions that I'm actually working on with people that have come to me wanting me to review their book and to encourage people to read the book. But I'm currently reading content right now and kind of putting things together so that I can give a good presentation of the book. I'm not gonna recommend any type of book or anything that I would not want to read myself. Okay? Shout out to Amiri, man. How you doing, brother? Good to see you in here. So, with that being said, I haven't done content in about 5 days or 6 days. So we're gonna talk about therapists on YouTube. Okay? We're gonna talk about therapy. When I talk about therapists, I'm talking about psychologists that are on YouTube. We're going to talk about social workers who are on YouTube. We're going to talk about licensed professional counselors like myself. Any type of mental health professional, psychiatrist who has a license to operate, or even if they have a non license and they have the education and they're operating in some capacity. We're going to talk about that. Last 2 weeks, guys. And yes, in case people want to know, hashtag James. And I'm going to explain why I did that. For those that don't know this young man, you can go look him up. He's all over YouTube. He went viral for quote unquote putting feminists in their place. If that's such a thing. But I'm going to say this before I speak on other therapists on YouTube. I'm going to first speak on myself. Okay? When I first came into YouTube doing content in 2017, most of the therapy content, as far as in the mental health sectors and things like that, were just basically people who were not necessarily interacting with one another as a sector. They were just independent therapists creating 5 to 10 minute videos talking about how to become a therapist, how do you start a practice, how do you operate, type of clients you see, things on helping people choose a good therapist and feeling more comfortable with seeking mental health and just educating people on mental health. Um, I came into YouTube doing similar. I spoke on a lot of different issues that related to the black community. I wanted to always emphasize the community that I'm from. And that's what I did. Now, things changed as I found myself, you know, gravitating to sectors like the pro-black sector, the manosphere sector, the black sector, then creating the Umar sector, and all these other different sectors that are far and few between. Okay, my intention was never to really venture off into other types of content creation to function in those sectors. So I started off kind of like what I'm doing right now, where I was very, very vanilla with my language, very professional. I talked about the day-to-day operations as a therapist, as a business owner, as a person who's a clinician, and dealing with the things that one would have to deal with as a therapist and operating in the community, providing services to the black community or abroad, and dealing with all the things that pertains to my profession. Okay, I talked about practices, I talked about contracts, talked about insurances, educating people on things to help them qualify to obtain things, and so on. Once I became connected with other sectors, the professionalism that I once operated went out the window. Okay, I was put in positions where I was disrespected, called names, disparaged in unfair ways. I was doxxed, and so I got sick and tired of people disrespecting me. So then I started doing the disrespecting. I started doing the roasting, and then and saying all kinds of negative things that I shouldn't have done. Okay. The problem is people didn't expect me to act in the way that I was acting because they didn't think, because of the way I initially presented myself, they didn't think I had that in me. And then when they saw it, they were appalled. And I had to let them know, I'm not going to take disrespect. I'm not going to allow you to speak on me and say all kinds of things, come disrespect my channel. And so I shifted away from that in order to operate in sectors. Okay? Now, what I didn't engage in was compromising my professional integrity. Let me repeat, like a good brother, Prince of Pan African, what I'm not willing to do is compromise the foundation of my profession in order to grift, to placate, and cater to any sector or any group of people. I don't give a damn if you're paying me or not. I am not willing by any means to compromise the integrity of my license, my profession, for clicks and views and a few super chats and interviews and quote unquote consultations and courses, ebooks, and things of that sort. I am not willing to do that. And I want to say this to Jeff St. James, if you are listening, because I know you're watching YouTube, because all you're doing down is watching YouTube to watch yourself grow. What you're doing right now, brother, is you're compromising the integrity of for yourself, and also the integrity of the field of counseling and psychology, okay, to cater to people who don't give a damn whether or not you have a licensure in Pennsylvania or not. And I looked you up. You are licensed. Just like you can look me up and see I'm licensed also in the state of Texas. But I'm not willing, and I was not willing, because what you're doing, Jeff, is not anything new. I operated in that same space that you're operating in, and I came from a different perspective, a perspective that they didn't like, because the perspective that I didn't like came from a position of objectivity, not subjectivity, based on manipulation of statistics, professional information, and fallacies and theories that are not scientifically, okay? And so when I came into this facility, I'm sorry, when I came into, I'm saying, I was debunking bad information, poor use of research, poor use of statistics, poor use of psychological terminology. Okay? If you listen to Jeff St. James, Jeff St. James sounds no different than any other manospheric content creator. It's just that he is more composed and polished in his delivery with a sprinkle of a little counseling or psychology related terminology. Okay? Now let's talk about other people on YouTube. Okay? We could go with Umar Johnson, unlicensed, certified, unlicensed psychologist, certified school psychologist. There is a difference. Has said some things that has compromised his integrity, but it's not that in itself. He's operated a little bit outside as it relates to medication and talking about ADHD. But he has done other things as it relates to the people that he's helping and creating dual relationships and et cetera and et cetera. I don't want to go on and on about Umar, okay? There's a guy called the kosher clinician. The kosher clinician is basically a person just like Jeff St. James who has misused psychological terminology to fit the perspective of red pill theology. Okay? The only difference is kosher clinician is older and just doesn't have the charisma, and people just don't gravitate to him like they do others. Okay? He's just seen as an older guy. He has went to different venues and he's went to the meetups and all that different stuff, and he spoke from a male supremacist perspective as a therapist who only provides services to black men who are in prison. Okay? I get that. I want to preface something, and it doesn't matter if you're a male therapist or a female therapist. I am not a fan of clinicians who have gender only they have gender specific practices, or they've only worked with one gender or the other. I'm not a fan of male therapists having all female or all male basically clientele. They refuse to or don't want to work with the opposite sex or specific sex. I'm not a fan, and I see a lot of this, particularly for black women. There's therapy for black girls, and there's all types of things, which I commend. There is a necessity for that, but I am not a fan as a professional of people who have who come into this field and they only are able to provide services to a specific gender, and you have the skills to help people out of a different gender or sex, and you are limiting the access. Okay, you're limiting in the field of counseling. Only 11%. So, in my opinion, we don't have the luxury to want to create practices, niche practices, to only deal with a certain group of people, because our community doesn't have enough therapists. It literally makes no sense to me. Now, I can't tell a person who and how they should operate their practice. I'm looking at this from a just strictly from a standpoint as a black therapist, knowing damn well that we don't have enough representation. Why would I limit myself to only treating black men? That makes no sense. If I was a black woman, why would I limit myself to only treating black women when you know you have the skills that are necessary to treat everybody? We should be treating as many people in our community that want the help. Okay? There are not enough black male therapists to go around. And there are not enough black female therapists to go around, period. Okay? And that's just the facts. Now, there are those that may disagree with me, and that's fine. You can disagree with me, and you as a therapist, you have the right to decide who and what and how you want to operate. And I'm not telling one, but I'm telling you from my perspective, this is my channel. You have a right to have your perspective. I have the right to have mine. Okay? But there are not enough black male therapists and female therapists. We only make up 11%. Okay? And I'm sorry. Every major city in this country has a demand for black therapists, period. We're underrepresented in every major city that has a black population. And that's just the facts. Okay? There are tons of different therapists. And many of them operate that I've mentioned. There's the guy, Dr. Grande. There's the other guy, the Canadian psychologist. He ended up losing his license. And there's amongst others. For the most part, many of the therapists that are online that act within their profession, many of them, they act very conservative for the most part. I'm going to be honest. For myself, I have came out of myself and act in all types of ways that were criticized. Okay? There are other therapists who've done the same. There's another female therapist in Houston. I forgot her name. I used to interact with her a lot. She was part of the fourth quarter talk with Topaz. Shout out to Topaz. If she left, I don't think she's on YouTube anymore. But Topaz was on YouTube. Topaz lives in Houston. Topaz used to be a little controversial and get out of herself a little bit, but not that much. Here and there, it all depends. But Topaz stayed within the profession, and she talked about certain content that related to counseling and psychology. There was another guy named his name was Counselor Murray. He was basically a red pill apologist, looking for clout in the sector, and I didn't have much respect for him. And there are other therapists. Then you got therapists. You got people who are obsessed. They can be obsessed with you. They dox you. They look up your information. They may operate and think they're knowledgeable of the law and legal procedure. Then you got those who I've seen some therapists who operate in a position of having a blind support for the LGBT community, an overwhelming support that is undeniable and is in some way very fanatical, and they are charged to do negative things based on their support if they feel you have crossed them in such a way. Okay? So my position is that when you look at therapists on YouTube, there's a wide range of behaviors that you may see. You may see those who operate within the scope of their practice that, basically they don't interact with everybody. Shout out to Miss T. Pre. They don't interact with everybody. They basically just do their content. They do their uploads periodically, and that's it. You got those that go live and so on. Most of them just do 5 to 10 minute, 15 minute videos. Okay? There's a guy that I knew in Vegas. There was a guy in Vegas that I knew that he used to do a lot of assessments of certain songs, particularly hip hop songs, and he would give a clinical assessment of the mentality and what they're speaking of, and the themes that are in those songs. Okay, he was okay. Um, if you do a search, guys, of black therapists or just therapists, that's pretty much what you're gonna see. What you're gonna notice is that most of the therapists you're gonna see are women, which women make up the majority of therapists in our field. The overwhelming majority of therapists are white females. Okay, the overwhelming majority are white females, and I'd say white males. Okay, white females and then white males. Um, and then there's a small number of there are probably a small number of Hispanic male and female therapists, as just as black men and women. You may see a few Asians, Indians, and etc. I would say black men, white men, and white women make up probably 65% to 70% of the um, counseling field for the most part. Okay, but I think that when we look at how some of these therapists, I have an issue with therapists who are doing things, and I'm not saying that they're being unethical. I just think that it's a bad look for therapists because I don't wish, because I saw how Mr. St. James talked about, people are wanting to threaten his license, and is it worth the risk? Brother, it's not worth the risk. I'm gonna let you know that right now, as a person who dealt with people calling boards on me for all types of silly reasons because of my online behavior and things I stated that they didn't like, or because I supported someone. It's not worth you. You've been a therapist for like 10 years, which is not that long. Um, it's not worth it. But if you feel that you being a therapist is not as important, and I don't think you're going to lose your license on YouTube, but I think that you're putting yourself in a position because you're saying things that can be very conflictual to people who would like to seek your services in real life. Because I don't think your female clients would appreciate, just like we saw the TikTok therapists and others, where they were saying things. She was working in an all male, mostly male orientated facility, talking negative about male clients. You seem to have a large percentage of female clientele, and you're talking in a negative manner about all the deficiencies of your female clients and what you see. And it gets me the level of subjectivity. Like every time I see you, it's more and more subjective, no objectivity. It appears that you have come from a position of that is highly tilted within red pill rhetoric, which is not scientific. Okay, and you're leading with that. You're leading with that, and I get it. They claim you told the feminists off. Um, I'm gonna say this. I'm gonna tell you all what propelled me to do this video, because I was posed this question one time in the manosphere where they told me about how feminism destroyed. You're a feminist, D. Durrell, and you've been affected by feminism in your field. And I told you I beg you differ. Uh, the curriculum that which was Cape Crep accredited, feminism was only mentioned a handful of times as it relates to different ideologies of thought And how do we approach people who have these ideologies? Uh, it was rarely talked about how feminism has a stronghold on how counseling related services are delivered. That was never discussed. It was never talked about. Okay. It was never discussed, never talked about, didn't exist because it's just not true. So when I hear St. James talk about, and then they post him a question about feminism destroying or affecting, counseling and things like that. I was embarrassed for him, the fact that he would even say such things that are not true. Say such things as far as, in a marital or relationship counseling modality, that the therapist usually is playing referee and taking the woman's side over the man's side. That is hopefully not true in many situations, but that is not representative of feminism. That's representative of the lack of skill in the clinician, because you're coming from a position of objectivity. You're coming in a position of being therapeutic. Okay. If you and I do relationship and marital counseling. Okay. That's a secondary, that's a secondary specialty for me. My primary specialty is mental health. But when you come from a position of compromising yourself, and you're coming from a certain perspective, and you're not willing to be open as a therapist to things, you got to be open. You're not allowing your own personal experiences and morality and values. And so when you uphold red pill ideology, you're violating ethics and coming from a certain moral standpoint. Okay? Red pill, no theology. I was raised as a Baptist, as a Christian. I would never allow my beliefs as a Baptist Christian to interfere with the attitudes and issues that a client is going through. My personal values, my personal experience has no place. And that is fundamental as a therapist, to understand that your personal experiences, your morals, your personal beliefs, your ideals, your values have no place, and you have no reason to try to force other people to have your beliefs, or use your beliefs as a means of trying to get other people to think in the manner that you do, that you would. That is unethical as a therapist. That's highly unethical. When you take on these type of ideologies that have proven to produce people who have been a detriment to society, there's tons of research on the lack of productivity of people who have those type of ideologies, the propensity for these people to commit crimes, violence towards women. They've even had people that listen to manospheric red pill content that have committed crimes, horrific crimes. And it was all fueled by red pill content on YouTube. I came from a position of telling people how this is actually harming black men and it's not helping you. Just because you're speaking in an environment where everybody agrees with you don't mean that you're right. It doesn't mean you're always wrong, but it definitely don't mean that you're right. But it means that you have allowed yourself to be in a cesspool full of people who are leading you in a bad direction that doesn't necessarily translate to a positive outcome in real life as it may translate to online. Okay. And of course, I was seen a certain way. And listen, I didn't care because I was not willing to compromise my professionalism. Okay, I was not willing to compromise my professionalism, my education, my skill level to fit the needs of strangers on the internet who have taken a uniform perspective on a failed ideology, an unproven ideology, and an ideology that is filled with male supremacy and hate. Okay? Whenever I'm seeing things such as someone speaking from a feminist perspective, a conservative perspective, a male supremacist perspective, a female bashing perspective, in which we're speaking of all the inadequacies and not all of the positives, that is a problem. Okay? But for the most part, the overwhelming majority of therapists who are on YouTube operate at a high level and at a very, very professional, positive frame of reference. Now, the minority of black YouTubers or YouTubers that are licensed, like myself and others, we've kind of varied out. And listen, I'm not taking away the fact that I've never done anything intentionally to cause harm to anybody. I've never caused harm to anybody because I've never attempted to do anything as far as direct services online. That's a no-no. However, in some of those frivolous attempts to get my license taken, the board made me aware that I was, maybe I may need to stray away from certain talks. That's why I stopped talking about when I did other content in those sectors. Anybody mention anything about mental health or diagnoses related to somebody having that narcissistic personality disorder and all these other different things, I kind of strayed away from those type of discussions because I knew that the people who claim that the person had these behaviors didn't know what they were talking about, and they in all intents and purposes were wrong. Okay, we cannot clinically assess anybody without that person being in a therapeutic environment where we are in direct communication with them in person, or in a telemedicine environment. And that's just not meaning online, but it's in the privacy of two people in a room without other people watching or having the ability to witness what is going on. Okay? So overall, I like the content that most therapists discuss on YouTube. I would like to see more continuity with certain therapists doing content together. I don't see that, but as far as independently wise, and I think most people just prefer to just do their content and not be involved or interact with other people. I've grown to understand that, and I because it does take more time out your day planning and dealing with other personalities. When you're involved in a sector, it can be. What's up, Misunderstood? How are you? When you're operating in the confines of a sector, the day-to-day can be draining. Okay? But most YouTube therapists, they do act in a professional manner. They do come from a positive standpoint. But there are a minority of those who find themselves involved in shenanigans that they should not be involved in. Okay? They should not be involved in those things. Also, my good friend, the Oracle that's in the beef set, she was a social worker. The Oracle, I don't think she's no longer licensed, but the Oracle, she didn't come from a position of being a social worker, but she's done content with me years ago where we did talk about mental health. Okay, what's up, TMK Media? But when I'm seeing, certain people just We're going to go with what everybody else says. I'm going to come from a standpoint as a therapist. And this is why this, and I'm using my training to express and say things in a certain way that people cannot, no one can necessarily um, challenge it because they don't know the frame of reference that he's coming from. They're just seeing this guy speak eloquently about this and certain things, and they're just assuming he knows what he's talking about. And in all actuality, a lot of what he's saying is not incorrect. And any competent therapist could speak in a different direction to prove that a lot of what he's saying is BS. And that's just the facts. That is just the facts. But listen, if I wish the brother much success. However, you're operating in a way that I think demeans the field. There are not a lot of black therapists. Black male therapists were 4%. Black female therapists, 7%. Okay? Our community needs us. You know, I saw a video talking about why black men don't go to therapy. That myth is stereotype is slowly going away. There are black men going to therapy. Now, there's far more black men going to therapy now than they were 20 years ago. And you know what? There's far more black women going to therapy. Okay? And the fact of the matter is that I want everybody to understand that going to therapy does not mean you have a mental illness. Most of my clients, I'm going to say the majority of my clients, not the majority. I'm going to say about 35 to 40% of my clients don't have a mental illness. The other 65% have a diagnosable, they have severe mental illness that requires ongoing care. I appreciate you all for admitting. Now, I'm not asking anybody to disclose whether you go to therapy or not, misunderstood or nothing, phone, but I do appreciate you all for admitting you go to therapy. I listen, I think that it is a honorable thing to do to admit that you have issues that you need assistance to work out. Okay? And holding it in, not resolving those issues can have long-term effects. That's why you wonder why you see people act in rage. When people you see act in rage or they have a psychological break all of a sudden over a minor incident that tilted them over, it's because there's years and years of things that they have been battling with that they finally got out, or hurt somebody, kill somebody. A lot of that is pent up, issues that were never able to release in a positive and therapeutic manner. Okay? And the issue is that, and I'm gonna say this, as it relates to black people and people, period, they don't want to feel like a person that wants therapy doesn't want to feel like they're ill. They don't want to feel like they're mentally ill. They don't want people thinking they're crazy. Okay? They don't want the therapist to look at them like a lab rat. They want the therapist to look at them like a person. That's why for myself, and you can look this up, I ascribe to what's called person-centered therapy. You can look it up. Person-centered therapy is a humanistic approach that focuses on congruency, positive regard, unconditional positive regard towards someone, reflecting, summarizing, repeating statements, okay? Asking open-ended questions, things of that sort. But what we're doing is we're the focus is is to communicate in such a non-directive manner that a person feels they develop the trust and the freedom to speak in a manner where they can get these things out with no shame, with no anxiety, okay, with no hesitancy. Okay, I just had a client yesterday. I had a kid yesterday that I was counseling yesterday, and a big part of me helping him was the fact that he had a little anxiety coming in to therapy, and he's been in therapy before, but seeing a new therapist for the first time. Once I got him to kind of release some of his anxiety as far as not knowing what to expect, he was very open in expressing himself. So if we want therapy sessions and the usage of therapy to be in a position of normacy, okay, then I think that it is healthy that people continue to educate themselves on mental health and the fact that going to therapy doesn't mean that you have a mental illness. Even if you have a mental diagnosis, doesn't mean that you're mentally ill. That just means that your behaviors go in line with a certain criteria that we have assigned to you to fit billing purposes and also therapeutic purposes, okay, to help you long term, okay? But we should not be we should not be ashamed of going to therapy. No one should be ashamed to getting help. You go to the doctor if you have a medical issue. You go to the dentist if you have a oral related issue. Okay, you want to get your hair cut. You go to the barber. If you get your hair done, you go to a beautician. If you have mental related issues, you go to a therapist. Plain and simple. Okay. It's nothing to be ashamed of, okay? And a lot of what therapy does is prevents you from actually going on the deep end and being developing severe mental illness. That's really I would say, the largest benefit of therapy is that it prevents you from becoming chronically dysfunctional. From a psychological standpoint, if you become chronically dysfunctional mentally, where hospitalization or long-term hospitalization and medication is a requirement, at that point, you're mentally ill. Okay? People who cannot function without some level of institutionalization and long-term medication, and if they don't take those medications, they can find themselves hospitalized. Those people and whoever that may describe can be professionally seen as someone who is mentally ill. Okay? So I'm going to get out of here, guys. I got to get going. I have some things I have to take care of, but I want to kind of touch bases with you all today on, therapists on YouTube. I will be doing more content to focus on some things as it relates to Mr. St. James and others who are saying things and misrepresenting therapists online. You all have a great day. Peace.